Lagos is not just the industrial nerve center of Nigeria. It has always been a trailblazer when it comes to infrastructure development. It has remained a compass through which other cities locate themselves on the map of economic advancement. Welcome to Inside Lagos. I'm Adedoja. Salam Adeniyi.
Ẹni tí ò dé kò yìn ẹkù kan. Àwa ni center of excellence. Ẹni ò dé kò yìn ẹkù kan. Àwa ni center of excellence. Mo ní pé bó o bá dé kò yìn ẹkù kan. Àwa ni center of excellence. Àwọn òyìnbó débẹ̀ wọ́n rí tá a jẹ́ ṣe. Àwa ni center of excellence. Haúsá débẹ̀ wọ́n rí tá a jẹ́ ṣe. Àwa ni center of excellence. Àwọn Ìgbò débẹ̀ wọ́n rí tá a jẹ́ ṣe. Àwa ni center of excellence. Gbogbo Yorùbá débẹ̀ wọ́n rí tí wọ́n mú lọ. Àwa ni center of excellence. Ẹni òde kò yìn ẹkù kan. Èkó ò ní bàjẹ́ lórí àwa. Àwa ni center of excellence. Ọ̀pọ̀ ò bá dé kò yìn ẹkù kan.
African governments are being asked to commit more to biosecurity at a time the global spread of deadly diseases and dangerous climatic conditions are plaguing the world. This formed a major focus of the 7th African Conference on One Health and Biodiversity held in Lagos, as the state set to build biggest infectious disease and research center here in Lagos.
Everyone in Africa who has taken the COVID-19 jab took an imported vaccine. That can be termed a biosecurity failure, which Africa must rise to beat, hands down. Being proactive on vaccine development and having the required biosecurity laboratories to track very fast killer pathogens like COVID-19, and also watching such agents closely to detect their mutation and control the spread of new variants with speed is very important. The big question is, how many African nations can boast of biosecurity labs 1, 2, and 3? Talk less of 4, the highest of the biosecurity labs. Lagos State fortunately has biolabs 2 and 3, but one state cannot bear a national burden. Neither can any state in any other African nation. 7th African Conference on One Health and Biosecurity is a wake-up call to the continent's leaders.
We cannot afford a situation where we were caught napping when it came to vaccine production. Nigeria has no business waiting for the rest of the world before getting vaccines for COVID-19. I hope that 2020 has been a lesson for us.
We are able to detect the multiple mutations that are emerging from COVID. This is done in a genetic lab, and happy to say that Mr. Governor has given us the resources to acquire this very expensive and very technically advanced skill in Lagos State to carry out genomic sequencing. So what is indeed worrying us is the plethora of skills that scientists are now acquiring to tinker with biological forms, bacteria, viruses, and agents that what we call gain-of-function research of concern. So if you're able to change a virus and make it more lethal for research, if we're not careful, these pathogens could escape. So these pathogens will be changed in a laboratory for research reasons to develop vaccines that are more effective, and if these pathogens are not kept in a very high security facility, such as a BSL-3 or a BSL-4, we may have an accidental discharge into the environment. Infrastructure is very important. For the past 5 years, we've been building infrastructure in Lagos. As you can see from this pyramid, there are 4 levels of biosafety categories, 1, 2, 3, and 4. In the last 2 years, we've acquired a 2 and 3 level. We don't yet have a 4. And if you look at the continent of Africa, you can see that there is a severe shortage of these biosafety laboratories. Only in Senegal, Ghana, Nigeria, Kenya, and South Africa do we have BSL-3 levels, and there's only one functional BSL-4 in South Africa. If you're going to be handling dangerous pathogens, you do need these biosafety laboratories to be able to diagnose them, manipulate them, and conduct research. There is a great need for nations to develop a biosecurity framework, and we're doing that at the moment across the West African region. We've already developed one in Lagos, and we're looking to work with the federal government to develop a national biosecurity framework.
Lassa fever. This is a disease that was described for the first time in Nigeria about 53 years ago. But then that disease up to 2008 did not have molecular diagnostics.
There are several areas of human existence which need biosecurity. But the Chief of Naval Staff, through his representative, called for attention on bioterrorism, which is the deliberate release of bacteria, viruses, or any harmful substance to kill people. He says a country plagued by terrorism like Nigeria should be at alert, watching against the fight being switched to biological warfare. Lagos State Governor Babajide Sanwo-Olu, who flagged the African Conference open, announced his government's plan to build the biggest infectious disease research center, as well as the biggest children's hospital in Africa.
Lagos, I'm sure you all know, remains a geographical entity with a significant vulnerability of incident of biosecurity threats. You could say because we're the only ones that have the biggest sea border, we're the only ones that have the biggest land border, we're the only ones that have the biggest air border. So all of the things that could go wrong certainly could go wrong in Lagos. And we're just a very small, tiniest part of the country. It is in light of that threat that Lagos has consistently powered, the Lagos Biosecurity Project. We recognize the need to optimize and sustain the use of our biological resources today, and we have responsibility to ensure that future generations can experience and benefit from the secure biospace that we all plan for. For us in Lagos, it's not just about what had happened with COVID, but it also gave us the opportunity to wrap up, our infrastructure on all fronts, be it training, be it, bringing in new doctors and new health officials. We've wrapped up even, our human resource in the health space by almost close to 2,000 new staff, in Ministry of Health and in the Health Service Commission. But more importantly, we've also are positioning ourselves to ask that even after COVID, how do we respond and how do we position the state, and our economy going forward? There's also the conversation around mental health. And so that's why we're building the biggest mental, health infrastructure also in the country. We're putting up infrastructure where, mental health rehabilitation and all of it, because we all talk about it, but nobody's taking action, in that space. So the Lagos State government is also building the biggest, mental health facility in the country, because we also don't want to be caught napping. Professor Abami also showed a picture. We're proud with what Dr. Happy is doing at Ede, but we want to build for you the biggest, African infectious disease center. Dr. Shuaibu to have said it. We want to be able to be in a position where we have the best, of biosecurity lab, and we have the best, of the technology, in which even in the event of anything close to this happen again, that Lagos or indeed Nigeria will not also be found, wanting. And we're not just doing that, we're building the biggest children's hospital also in the whole of West Africa. We're building, brand new hospitals that we believe that indeed we need to reverse, medical tourism, and where we need to just be able to work with the private sector and ensure that, they have, an enabling environment for them to also raise resources, and be able to build first-class hospitals in Lagos. We're so excited that in the last, 6 months, we've opened 2 very big, massive private hospitals that are comparable to any part in the world. And we continue to say that, we will create an ambience and an environment where even the private sector can do well and they can strive, to believe that government will continue, to help us.
On the sidelines, Governor Sanwo-Olu also flagged off the state's vaccine rollout campaign, which aims to have 4 million Lagosians already vaccinated by the 25th of December.
With a full understanding that a substantial proportion of the population will need
to be vaccinated to reduce the impact of ongoing spread of the COVID-19 virus and to prevent the emergence of the catastrophic that we've witnessed in previous waves. There's a potential for a fourth wave, and so the state has developed a robust vaccination strategy, leveraging on both the strength that we have in the public and particularly in the private sector on our health system. One of the major driving forces we have in the development of our strategy is the protection of our economy. As we continue to strive to live with this virus, we fully understand the external force it represents and continually implement the countermeasures to ensure we keep our economy open for business. Therefore, to mitigate against this potential damage and to further spread and to minimize further spread of the COVID-19 virus in the state. And we believe we want to also accelerate our efforts to achieve what we call an herd immunity. The need for a different strategy has become a front burner issue. This is what we have therefore culminated in this campaign, which we have tagged Count Me In. Its operation Count Me In. 4 million Lagosians to be vaccinated against COVID-19. And we believe that to target 4 million residents before the end of December 2021. Once achieved, this will bring the state closer to reaching my promised vaccination of 30% of our total population within 1 year. It is our hope that we increase the reach and access to the available vaccines provided through the generous contribution and donation by the federal government and of our various partners that are here. By doing this, we are once again recognizing the impact of collaboration between the private and the public sector for healthcare and for strengthening the link for far-reaching initiatives in the state. At this point, let me re-emphasize, and it's imperative for us to, like I said, re-emphasize that the vaccine administration in public facilities will continue to remain free to the public and to the entire public. However, whilst the vaccine remains free as they've been contributed and they've been purchased by the federal government through NPHCDA and our various donors, there's a little charge, of 6,000 that has to be approved for relevant stakeholders in the administration of private sector in the private in the private health facilities. And so this 6,000 will be for the 2 doses, will be the cost for the 2 doses, and I will explain what it is. This is to allow the private sector to recoup their resources that they've deployed in the process of administering the vaccine. We encourage all Lagosians, all our residents to visit our listed public facilities to receive the vaccine at no cost to them. However, those that wish to receive them in the comfort of a private facility can do so with this little administrative charge.
The 21st National Women's Conference, organized by the Committee of Wives of Lagos State Officials, COWLSO, ended in grand style. The committee also came up with 7 points recommendation after 3 days of deliberations. Let's bring you some of the defining moments of that event. About 6,000 women are participating both physical and online platforms at this year's COWLSO's National Women's Conference. This year's conference, themed Awake, is set to awaken women to move in tune with modern realities, to build capacities towards confronting scores of challenges bedeviling the nation.
In 2019, our theme was Unlearn, Learn, and Relearn, 21st Century Women's Team's Perspective. Last year, we were equipped with the right information to explore the possibilities in a new world. This year, our focus is making participants awake. Dear women, it's time to assert ourselves and contribute positively to our society. Don't be laid back. No matter where you find yourselves, Always remember that you have something to bring to the table. We all have a role to play, whether you're a grandma, or a career woman, or a housewife, or an entrepreneur, or a student, or a farmer. The very essence of this year's conference is encapsulated in the Chinese proverb, "When sleeping women wake, mountains will move." Women, now is the time to move mountains.
I believe highly that we have our husband's support, and the support is well appreciated. However, we need more assistance and communication to move together positively.
The conference gathers women with the aim of building capacity and utilizing same in their communities for social development.
The organizers and all of you have chosen a right topic. It directs our conscience, and there's an urgent need for us to brace up to the new and emerging reality of the 21st century. To be awake is to be in tune, understanding, like I said, all of the challenges that we all faced last year, but to come out of it and in 2021, to be well out of the pandemic and to be well out of the fact that nothing that we do, we men now, that we can do well without our women or without our female fold beside us. And so the charge out here today is to look at the changes and the emerging realities of our time. And I believe the word awake is not only apt, it's not only appropriate, it's for you to be a lot more resilient, to be aware of your environment, to have a new approach to doing things, to ensure that you have an integral and a sustainable mindset at everything that you find your hands to do. As individuals, as organization, as corporate entity, I think it's important for us to know that all of you, working collaboratively as partners with government, we can achieve a lot together, working in unity. You know that in our team's agenda, all of the processes and all of the programs that we have there, in one form or the other, is targeted at ensuring that we can put our women on the driver's seat. If we talk about health, we know what they're doing. If we talk about education, we know what they're doing. If we talk about infrastructure in Lagos, all of the strongest engineers that are leading our infrastructure in Lagos are all women, from Lamata to Lasiama to Ministry of Works and Infrastructure themselves to Scripts. All of them are strong, able women. So you can see that indeed for us as a government, we have actually awoken. We've said to ourselves that we need the women to be able to take the right position. And it's not just by mouth that they said that our government is a he for she. Because you can see all my lovely cabinet ladies that are all seated there. They are the reasons that all of the great things that we're doing. If you say we give them seat, there are several of them. I want to thank you all very much. We believe that when we have you leading the conversation, because they've said it, when you train a man, you are training an individual. But when you empower and you train a woman, you are training a whole village, and by extension, you are training a nation.
Ondo State Governor Rotimi Akeredolu told women to look beyond being the wife of the state officials, but aim higher as they have all it takes to lead the country.
You can't confine women to the back seat and expect that you make progress. If this country must progress, we must move with our women, or women must lead us to progress. I have, in Nigeria, problem, I've been to the mountaintop, and all I can see is women coming to serve this country.
The Inspirational Women of the Year awards were given to Wonola Folami, Foluke Abdulrazak, and Bintu Fatima Tinubu for their age-long services, humanitarian and philanthropic activities for women, children, and the society at large. Nigerian professional footballer who plays for Spanish side FC Barcelona, Asisat Oshuala, also was awarded with the Inspirational Youth of the Year for setting up a foundation as a way of reaching out to women and girls. It's day 3 and the closing ceremony of the 2021 National Women's Conference with the theme, Awake. Seasoned professionals took the women through the journey of how to position themselves for leadership and still hold their rooms. Chairman of the committee says the positive impact of this conference will be felt in all spheres like the previous editions.
We had all these various topics: cervical cancer, all there is to know, substance abuse, youth restiveness, child molestation, the fallout of a failed family system, work-life integration, a process, not a destination, savings and investment opportunities, the roles of record keeping.
Constructive surgery, like you've said, because it's very expensive.
After much deliberations, they resolved that the national and state assemblies should pass laws instituting policies to enable workers to pursue more balanced lives. Families should employ intentional and co-parenting dynamic to ensure the foundation is not destroyed. More women in leadership, equal opportunities and education for girl child, and zero tolerance for any form of abuses, among others.
I want to reinstate that the commendations and the recommendations that will be coming out of this conference, we will take them very, very seriously. We will look forward to implementation of all the recommendations and the suggestions that you plan out, for us in this conference. I also look forward to some of the implementation of our own projects. We are doing a lot of things in health, in education, in public transportation, in security, in good governance, in housing, in power, in all of the spheres of life. Why are we doing all of this? We're doing it because we want to change the narrative. We want to bring about a better tomorrow for all of us. We want to create a greater Lagos that all of you will be truly, really proud of. That's why your government, our government, will continue to ensure that we can raise the bar of governance. We can continue to remain relevant in your life. We can continue to provide opportunity, whilst you can do very well in whatever chose of endeavor you find yourself. And government and governance, it's about creating opportunity, creating the space for you to flourish. And I know that a conference like this, I've also given you that networking opportunity, that capability, that indeed you have awoken. Indeed, our women will take the rightful place in the society. Indeed, we know and we appreciate in our government that without you, we're nobody. And that's why we'll continue to provide that enabling environment for you to do well, and to excel. It's no longer news that Lagos is a he for she government. I'm sure if you check the number of permanent secretaries that we have, you'll see that consistently 65% of them are women. If you check our judiciary, both at the magistracy and the high court, you realize that over 65% of them are women. I've just mentioned to you also the chairman of our commission. You realize that a significant amount of them are women. It's only in the cabinet that we try and make sure that they are 35 or 40%, and we'll continue to do that. Even coming out from our local government election, we've now recruited, we've now employed, we've now appointed, we've now elected more women as chairmen of our local government than we've done before. So Lagos and Lagos women, there's a lot that is still in stock for you.
There's no shame in copying what is good. Lagos is doing well. Edo is doing well. And there is nothing wrong with collaboration. We will take some of the lessons we have learned from this, and we will also carry it out.
Please, can we applaud?
At the event, awards were presented to Friends of COWLSO. The conference also witnessed several prizes won by both physical and virtual lucky participants, including a 3-bedroom apartment worth 25 million naira, brand new cars, and return tickets to London at the gala night.
She just won a return ticket to London.
Formally declare this conference closed.
And that's a package on this episode of Inside Lagos. Many thanks for being a part of it. I'm Adedoja Salam Adeni. Get vaccinated. See you next time. Bye-bye.